Good morning and welcome to another Learning Pack Day. It's been great seeing so many of you engaged in the virtual assembly. The past year has certainly brought its fair share of challenges, but it's been an honor to serve as your Aopa president. We are resilient. Today's date, 9/11, reminds us of a different national challenge we had to overcome. Although different, throughout COVID, you've all gone far above the call of duty to ensure our patients get the care they deserve. I witnessed how well we all adjusted quickly and nimbly, providing care via telehealth, instituting new policies, and very importantly, sharing lessons learned and best practices with one another, often through Aopa. Like all of you, Aopa had to adjust as well. However, we stayed true to our mission. Through advocacy, research, and education, Aopa continues to improve patient access to quality orthotic and prosthetic care. Just last year, I spoke to you about a perfect vision for the world of O&P. For me, that's a world where O&P clinicians are universally considered to be part of the healthcare team and appropriately reimbursed for the services we provide. A world where we have an adequate workforce to serve all whom need our care. In a world where patients get the O&P care they need, where and when they need it. So this year, in spite of COVID, we focused on the elements that'll get us to that perfect vision. I'm happy to report, because of my predecessors, the current board, Aopa staff, and most importantly, you, significant progress has been made. On the advocacy front, Aopa pushed hard for federal policies to protect our O&P businesses and preserve patient access to quality care. As you heard earlier in the week, the Medicare O&P Patient-Centered Care Act has been introduced in both the House and the Senate. Differentiating O&P from DME has been even more imperative given the impact of COVID and recent OIG reports. In order to provide patients with the best possible care, we must be seen as medical providers and then reimbursed appropriately for providing clinical services. To further help on the policy front, we monitored insurance trends across the country and assisted members with challenging reimbursement policies. We fought for legislative and regulatory fixes to help address COVID impact. We held a successful leadership summit where we explored critical topics, including diversity and inclusion, the emerging presence of manufacturers in clinical care, and the continued need for evidence-based practice. Finally, we held a well-attended virtual policy forum to take our collective voices to the Hill. Our research efforts over the past year helped get us closer to that perfect O&P vision I spoke of. Through them, we reinforced the clinical efficacy and effectiveness that we as clinicians provide. In 2020 alone, Aopa awarded $139,000 in research grants through the Center for O&P Learning and helped elevate the O&P research that has been done through previous funding. This further helps us define our value to healthcare. We didn't let COVID get in the way of Aopa providing members with a variety of educational opportunities. We moved to virtual formats and added content relevant to the demands you were facing, including why we're all here today, to get the best in clinical and business education. In addition, due to furloughs and budget cuts, we provided access to Aopaversity free to all members. We continued to work with key stakeholders, AAOP, NAAOP, ABC, BOC, and NCOPE, as well as the Amputee Coalition on these these and several strategic initiatives, including our new partnership with the Amputee Coalition. As a result of this partnership, Aopa's patient care facilities can provide Amputee Coalition materials to their patients for free, and will also be listed on the Amputee Coalition website as partners. But even more important than the collaboration from these organizations is the feedback, support, and engagement we get from you, our members. This year, we launched our second call for volunteers. Hopefully you saw it and responded to it. The board and staff reinstated their commitment to diversity and inclusion and will be launching a new initiative to further this in upcoming weeks. Get involved. We need all our voices. I'm proud to have been a part of these efforts. Today, I'm here to say thank you for your membership to Aopa. I want each of you to reflect on who you are in our profession. You serve the mission every day by providing quality orthotic and prosthetic care for our patients. It's a true passion. Thank you for all you do for the profession and your patients. Thank you for your support, and I thank you for this opportunity to serve as your Aopa president. I would also like to thank our excellent Aopa staff under the leadership of Executive Director Eve Lee. You are all incredibly talented and dedicated to our organization. It has been an honor to work with you. I now call the 2020 Annual Business and Membership Meeting of the American Orthotic and Prosthetic Association to order. In the handout section, please find the agenda, the minutes from last year's membership meeting, and the 2019 financial report. If you have any questions after reviewing them, please do not hesitate to reach out to the Aopa office. Our first order of business is to present the slate of candidates for the 2021 Board of Directors. Before I do this, I would like to recognize all of Aopa's hardworking Board of Directors, including your Executive Committee, Jim Weber, immediate past President, President-elect Tracy Drawley, Treasurer Jeff Brandt, and Vice President Dave McGill, as well as board members Doug Call, Mitchell Dobson, Kimberly Hanson, Terry Cuffle, Elizabeth Gonzell, Rick Riley, and Linda Wise. I would also like to thank the efforts of our research chair, Dr. Shane Wordeman. This year has been a challenging one, and you've all risen to the occasion. Thank you for your efforts, board. I especially want to thank Jim Weber, my hero who stepped up and served 2 terms as president. Jeff Brandt and Doug Call, who will all be leaving the board. Your energy and efforts have led to Aopa being in a much better place. About a month ago, you received a notification indicating, due to COVID, that the election for the 2020 and 2021 board cycle would be slightly delayed. Today, I'm pleased to be able to present the slate of candidates. Tracy Drawley will be president. I will move to immediate past president. Dave McGill will be your president-elect. Terry Cuffle has been nominated as vice president, and Rick Riley, who currently serves on the board, has been nominated to serve as your treasurer. Kimberly Hanson, Elizabeth Gonzell, and Linda Wise's terms will all continue as directors. Jim Young has been nominated to fill Terry Cuffle's seat. Mitchell Dobson has been nominated for another term. Mo Kinney has been nominated to fill Doug Call's seat. And finally, in the coming weeks, the nominating committee will appoint someone to fill the seat that Rick Riley, moving to treasurer, is vacating. In addition to voting for the board of members, Cuffle, Riley, Young, and Kinney, You will also be asked to vote on a proposed bylaw change. This change to Aopa's bylaw will ensure continuity of the board and limit disruptions in board service. Additionally, it'll allow the nominating committee to fill board spots with the best possible candidates and will continue to allow Aopa to advance its mission and serve its members. You will receive the ballot on Friday, September 25th, and have 30 days to cast your vote for both the board members and the bylaw change. And now I would like to invite Aopa's Executive Director, Eve Lee, to present an association update.
Thank you, Jeff. And thank you all of you for being here with us today. You've just heard from Jeff some of our accomplishments over the past 12 months. And now it is my pleasure to share an exciting new update with you an exciting new announcement with you today. Over the past 6 months, staff has been working hard to improve your connection to your Aopa benefits. Later this fall, we will be launching a new association management system called Aopa Connection. This is going to be you and your staff's one-stop shop for all your member benefits. You will be able to pay your dues, make event and bookstore purchases, access Aopaversity and track the Aopa education you've completed, access the co-op, and get in touch with the Aopa experts to have your coding and reimbursement questions answered. In addition, you will have the ability to communicate and share resources with other Aopa members. Be on the lookout for details on how to access this new platform. Through Aopa Connection, we truly hope you will be able to improve your business. Thank you for all you do for Aopa, and more importantly, for those living with limb loss and limb difference.
Thank you, Eve. It's now my pleasure to welcome your incoming president, Tracy Jolly, to offer remarks.
Thank you, Jeff. It has been a pleasure and an honor working with you this year. Your steadfast leadership has successfully guided us through an unimaginable year that required us to swiftly pivot to meet the needs of our members and the O&P profession, all while ensuring we never lost sight of our mission and our focus on collaboration. On behalf of Aopa, thank you. As we turn our attention to the coming year, I'm confident that by working together through advocacy, research, and education, we will see great successes on behalf of those with limb loss, limb difference, and limb impairment. Together, you, we, all of us, will ensure greater access to the quality orthotic and prosthetic care they need and you, our members, provide. And as we look to build on who we are, we will continue to push for the separation of O&P care from DME at the federal level. And after recent successes with Blue Cross Blue Shield, we know we can also have an immediate and significant impact at the state and regional levels with private payers and Medicaid. Therefore, we will be making a renewed commitment to support these local advocacy efforts with you. As Jeff mentioned, Aopa awarded nearly $140,000 in pilot grants and supplemental funding this year. In 2021, we will look to expand funding for outcomes-based research and continue our support for the implementation of the Lower Limb Prosthetics Registry. While education has become Zoomcation, we know the power and importance of providing virtual education, including on topics like coding and billing, the co-op, prior authorization, PPP, CARES, and a few other acronyms we all learned this year. Whether you're working from the clinic, the office, or your home, we will provide and adapt our educational needs and services to meet your needs wherever you are. As Eve mentioned earlier, Aopa is launching a new platform called Aopa Connection that will allow each member of your business to more easily access Aopa's benefits, and connect with one another and the talented, resourceful team at Aopa. So log in, explore, and let us know what you want, your business's needs, and if you would like to volunteer. Remember, Aopa is here for you. Thank you all for all you do for Aopa, the OMP profession. I look forward to working, listening, and learning with you in the coming year. And now, Jeff, I'll turn it back to you.
Thank you, Tracy. I look forward to supporting you in all your efforts. I couldn't think of a better way to conclude our annual business meeting than a reminder of what it looks like to be an Aopa member. Thank you for your service. I now call the 2020 annual business meeting to a close. I hope everyone has a great day.